The global thought of health and wellness beyond simply curing a disease or an illness really appealed to us. To create an environment that linked in other elements of health and wellness and education and connections to a community and recreational activity for the very young to the very elderly. We had a unique opportunity on the site to do that.
The hospital came into being because of the advocacy of all the community members back in the 60s. We were surrounded by a cornfield when we opened up, and now today we're surrounded by homes. So we really paid a great deal of attention to what would be the future, and we know that patients and their families are all part of the whole healthcare team. So we wanted rooms that were large enough that they would feel that loved ones could stay with them, 1, 2 chairs, a sleeping bed, a pull-out coach. There would be room for that. And fortunately, the B+H team, along with Suzanne, really brought that to light for us.
We had design meetings going with our users, and we had 2 meetings going simultaneously because we had such a push on the schedule. So we'd have one group upstairs, one group downstairs, and I'd be running up and down trying to make sure things were flowing and that what people were requesting was still in concert with what the functional program had to say.
We look to doing a more vertical organization around very clear components, including an atrium space that allows a direct view of where you're going in the project. So sunlight has a calming effect, being able to see sky, having some reference to the exterior is very important. When the community comes in, they can see where they're going. And of course the added benefit is there's less travel time because you're just going directly floor to floor, and there's direct connection between departments, connections up and down instead of spread out across the site.
I think what's probably unprecedented is the actual physical link to the East Markham Community Center and Library. The fact that you can walk down the corridor and from one project to another, the bridge that we put in between them, working with the town and the hospital and the community to develop a solution, gives it access to facilities that I don't know any other hospital in Ontario that has that connection between both the acute care and the health and wellness component that's embodied in the community center and library.
The thing that stands out for me the most with this project is really the partnerships that we've created. They've been fantastic.
When we were at the Markham Town Council, it was an endorsement, and a pretty enthusiastic endorsement of what this created district within Markham could contribute to that neighborhood and the whole Markham Stouffville community as a whole.
There was vision when we designed this hospital, and the vision was to say, this is for our community. This will make people feel connected.
I'm sure they take care of everybody equally as they did to me, but to me they're my guardian angels. That stained glass piece, that's a minute little thing.
People actually can stay healthy and prevent illness, and they can use the community center for that. Then they need rapid and quick diagnosis, and that comes from us. And then they need rehabilitation or healing, and that comes from the community center. So it's a perfect continuum for the perfect future of healthcare, which is us owning our own health, us owning our own illnesses, and helping to work with the healthcare team for us all to advance together.